David Cloud is at the Vera Institute in New York City. Among other things, he does legal and ethical issues arising in adult mental health courts, which I think prepares you really well to be thinking about this issue because these are really tough issues. David.
Thanks. Good afternoon, everybody. Thanks for having me here. It's been a pleasure and a very interesting symposium so far. So what I want to talk to you all about today is this issue of justice and health systems sharing data. What can we gain from that? What are the opportunities? And also, very importantly, what are the ethical dilemmas that we get into when we do it? So my program, just a little bit of background, we work on a range of issues that are kind of at the interface of public health and criminal justice systems. We have this overarching thing of bringing large data sets together to solve a problem, whether it's helping people re-enter society out of jail and tailoring services to their needs, to diverting them from the criminal justice system somewhere after arrest. So we're all into using data from multiple sources to solve problems. So the past couple of years I've been working on a resource. So what we've learned is that justice systems and health systems, they have different institutional cultures, they have different priorities, and they really don't communicate very well. And you may know that mass incarceration is a serious issue, but something that's less talked about is the extent of health disparities inside prisons and jails. Ironically, they're the only place you have a constitutional right to health care. For a growing percentage of people, like in places like New York City, for example, while the prison population has gone down dramatically, on Rikers Island, we actually see an uptick in the number of people that are predominantly nonviolent, serious Axis I psychiatric disorders kind of flooding the jails. Jails have become kind of de facto treatment providers. And the problem is that they're transient institutions. People are in, they're out, they're in, they're out, they're in the community. And the agencies that are kind of supposed to pick up the slack, the other kind of safety net agencies, they don't talk to each other. There's this silo. So what we did was we built an online resource to help practitioners navigate the various legal, ethical, cultural, and some of the technological challenges that arise when these agencies try to share data. I should have put the address up there. It's just jhconnect.org if you're interested in checking it out. So I just want to quickly hit on some of the four of the things that we can achieve by these systems sharing more data. So to avert a public health crisis, that's kind of the overarching theme. But we can improve continuity in care and the coordination in a couple of ways. So just, for example, imagine a man who has taken one antipsychotic his entire life. He's frequently in contact with the justice system. Well, he gets arrested. He ends up in jail. What they usually do is they have most jails have paper-based systems. He will be screened. They will ask him what his health needs are. And they may not detect that he's on a certain medication. They may not even detect that he has a mental health need. That can lead to a range of adverse consequences, from being put in solitary confinement, from being given the wrong medications. I won't elaborate, but a lot of bad things can happen. Sharing data, a lot of things we're exploring are taking things like electronic health records and building interoperability between community health systems and correctional health systems, going through the necessary legal loops and hurdles to ensure that information comes in. It can be used to improve medical decision-making, policy decision-making, the capacity for government to evaluate. Another overarching thing that we try to address is the underrepresentation of incarcerated populations in health surveys. So the last presentation on the census, things like the census and other epidemiology health surveys are largely household-based. So they underrepresent 2.3 million people essentially in jails that are just kind of not included in our conceptions of health need, the burden of disease, the things that we use in public health to formulate policy, allocate resources, and things like that. So I think there's a huge opportunity to use administrative data at least to start figuring out how we can improve and give a more accurate estimate of health need, especially in vulnerable communities. Transparency and accountability, that's a theme. I think just by way of example, violence that's reported in jail. So a lot of departments of corrections will report on instances of violences, whether it's inmate on inmate or whether it's a prison guard on inmate. There was a recent article in the New York media that was talking about how the electronic health records, that the data they had collected on violence through the electronic health records were in stark contrast to what the agency was actually reporting. Now, so you can just imagine that, there are these alternative data points out there that can more accurately represent what's going on in jails and prisons, which are pretty secret environments. And then I won't dive too much into this, but we're working a lot on helping agencies combine data sets to plan for health reform. So a significant amount of people in the criminal justice system will gain access, especially in states that opt to expand Medicaid, but they will also have access to substance use and mental health by regulation. So we're helping agencies pair their Medicaid data with their criminal justice information systems to kind of streamline enrollment, get people enrolled, and kind of achieve the mission of health reform in certain states. So what does it look like? Here's a very simple conceptual map of the different types of data systems I'm talking about. They range from correctional health systems, which are very behind the curve when it comes to health information technology, but a lot of them do have at least some type of electronic database. Some of them have electronic health records that meet kind of the meaningful use standards. And then, there's these other, what I'm kind of excited about, I'll just move on, is a health information exchange. If you're not familiar with these are state or regionally based data hubs that allow you to send information in and pull information out of a common population that you serve. New York City, New Jersey, a handful of jurisdictions are saying, hey, why don't we have correctional health providers be a part of this picture? And largely, they've been excluded. They exist kind of on this island detached from mainland healthcare, but we're seeing a lot of improvement in ability to detect need, get people the services they need, and save money just by this. So I'm really excited about the potential for this to provide rich data, and I can imagine some of the presentations we saw earlier today taking this type of data and turning it into this wonderful graphic displays of what's really going on. So move forward with that, please. So what are the risks? I mean, this is exciting stuff. We're a social justice place. We have our priorities in helping people, but we have to think about the risks. And I kind of just boil them down like this. The obvious one is privacy law. HIPAA, 42 CFR, state laws that protect mental health, substance use, conditions like HIV are much more stringent than HIPAA or federal law. So we always have to think about that, and we always have to help agencies kind of navigate when it's okay to share data, what procedures and steps they need to go through to share data. And then even if the law permits you to share data, it's a separate question for clinicians, public health community, if we can, should we? And the ethical issues, I think, arise out of this notion of data misuse. So if you're imagining all these social service agencies sharing data on someone's criminal justice, I like to think of it as the trifecta of sensitive information: criminal justice involvement, mental health involvement, and substance use. Those are three things that in ordinary life can be used against you, to affect your housing, your student loans, your education, or, a range of things that are kind of essential to existing in our society. So we have to think about the consequences of those. And equity and safety, this is just an issue I think we find mostly in jails, so we don't want to wrongly identify people as having conditions that don't necessarily have them. In a jail setting, it can subject them to victimization, being put in solitary confinement, and a host of other bad scenarios. So how do we alleviate these risks? I mean, I think these are tools that we're all familiar with. It goes back to the basics with fair information principles. So we help a lot of jurisdictions who have no idea. They're still using paper-based systems. They haven't talked to their public health commissioner in 5 years. We'd say, if you're going to share information, if you're going to work together, if you're going to collaborate, start with these principles. They're very basic, but they're embedded kind of within all of our privacy law, all of our statutes that protect things like autonomy, confidentiality, just really essential ethical canons. Informed consent. This kind of goes along with technology. So we're looking at jurisdictions who are experimenting with ways to do kind of uniform consent. So they're drafting forms that will have a well thought out kind of calculus of which agencies should share data and for what reasons And that needs to be clearly spelled out in the consent forms, and there's various ways to opt in and opt out. I don't have time to elaborate on all of those, but that's obviously an instrumental key in getting these two systems to communicate with one another. Another piece of technology is called data segmentation. And it's actually really exciting because what it does is you can kind of predefine access and visibility of data if you were to say to log on a portal and pull up someone's file based on who's supposed to see it, what your profession is, and what you intend to do with it. And then, of course, MOUs. We're all familiar with those. But in the information sharing world between these systems, they're essential because they set the parameters for why these agencies are sharing data, what they're trying to achieve, what the responsibilities are, and what the ramifications are for a breach. So just quickly concluding, I think it's an exciting time for us, in our field where there's a ton of opportunity to get these data systems to come together. But, there are also significant ethical dilemmas, and I'd love to hear from people in this room who are thinking more, innovatively about how to package this information, communicate kind of the social justice message, but then secondly to move forward with affecting change. Thanks.